Rebecca, can you tell me a little bit about your work at ONC? What division are you in and what kinds of programs do you handle?
Sure. So I'm the Medical Officer for Innovation in the Division of Science and Innovation, which is based within the Office of Science and Technology at ONC.
Yeah.
There has to be a lot of layers, right?
There are.
Working
Yeah.
in government. And I do strategy and programmatic development for the group of people that try to engage most with the entrepreneurial community, providers who are trying to experiment and iterate around health IT and digital health, as well as the investment community. So basically it's a relatively new division, about a year old, but we serve as a lot of that interface both for outreach to the community as well as engaging them more into ONC programming that existed in the past.
And as I understand it, you're very focused on innovation. So tell me how that works. How does that program work, and what kinds of projects might you be working on?
Sure. Innovation itself is obviously
big
and not particularly well-defined word and can mean a lot of things. So the way we've defined it within our group, are really the people that are experimenting and taking risk and trying to make healthcare better, enabled by health IT and digital health. So that means not just electronic health records, although we certainly have gotten involved in that process, trying to engage people who have smaller companies to be part of the process of public comment on regulations, engaging them more in something called the Standards and Interoperability Framework. So when we identify, it is actually really, really important and a great opportunity for companies to come in and say, I actually have this problem where I can't access a certain type of data. You know, the integration costs are astronomical, or there's no standard for the data to flow between this, electronic health record system and my maybe mobile application I'm trying to build. I want to be part of this conversation. So there's lots of ways that they can actually engage with policymaking and regulation and standards development that a lot of people in that community aren't necessarily aware of, so we do our best to sort of draw them into those existing processes. We also are trying quite hard to bring more of those companies in to just interface with ONC staff so that people making those decisions and doing the work every day within federal government are aware of what's happening on the cutting edge of, cloud storage, on, medication adherence applications, direct-to-consumer devices, that sort of thing.
Sounds like a big job.
It's a fun job.
Tell me about one of the things that your office has achieved recently that you're most proud about.
Sure.
Or excited about.
So I think one thing specifically that lets me talk about one of my most favorite initiatives, Blue Button.
Oh, of course.
You're doing someone else on that. Our group is very involved in a lot of the developer outreach for Blue Button and ensuring that some of the standards that are coming out, I see things like consolidated CDA, direct protocol, are understood by that community, and they understand that they can really leverage it to get data out on behalf of patients within those patient products. And we run a number of different innovation competitions, things like challenges, codeathons, been a lot of them over the last few years, but one in particular this year we were quite proud of because we brought together a large patient community, a large developer and designer community, and also some providers just to ask, now that this data is becoming liquid, and we have all these incredible companies out there that could take advantage of it, what use cases really matter to the provider community and to the patient community? And we had a big public call for crowdsourcing of those ideas. We had co-design, we had patients working directly with those developers and designers over the course of a few months, and then crowd voting on the ideas that people thought were of highest interest to implement soon. So I thought that was a really great way of bringing together communities that weren't necessarily working together, especially with the federal government, and doing it in a very sort of public, transparent way.
Exactly, engaging a lot of people in your processes. It's very good. So I'm wondering what you're looking at next and what might be a challenge for you that you're undertaking.
So I think the two next big projects for me are, one, actually taking the innovation competition program and not just stopping at building the technology, but actually getting that technology into clinical environments. So right now we're having a lot of conversations with potential external organizations that could be both clinical partners as well as other organizations that are aligned, that are research institutions and such, to say, okay, here's a priority product or a use case for patients and providers in the federal, from what we're seeing within the federal government. Now let's actually bring it into the clinical environment and start gathering real data and iterate. Sort of, again, support those providers and those institutions that really want to experiment beyond where we are currently with regulation even sometimes. So working hard on that this year. So if any of your viewers are interested in being part of that, I'd love for them to get in touch with me.
They'll be in touch.
I hope so. And then the second piece of that is, I think we've gotten to a place within meaningful use where, meaningful use, stage 1, stage 2, and stage 3 were supposed to do very specific things. Stage 1 really was just about, digitizing medical information, and we hear a lot that physicians hate that it's all about sort of like data entry right now, and they don't like a lot of the interfaces. As an MD myself, I used maybe 10 different electronic health records when I was at medical school at UC San Francisco because we rotated so many hospitals.
But you did use one.
And definitely use a number of them, as well as paper charts. They were still around at that time. Very much experienced that pain myself, but at the same time, that's kind of how stage 1 was going to be, right? Like you read the overall umbrella intention for it, and it was about just digitizing information. Now that we're moving into stage 2 that people are attesting for this year, in stage 3, that's when the push is really towards changing workflow and really having the opportunity, I think, to change the way that we provide care and use the data in really interesting ways. So as that happens, my hope is to really have a process for continuous feedback from that innovation community around are these tools now that they're in place, now that the data is in place, is it really working, and what do we need to adjust around the way? And again, there's many public forums to do this. That feedback on the regulations, it's public comment is open.
Yeah.
Right, so I really hope people will participate in that, but we'll also be doing a lot of work to ensure that we're reaching out to those communities that perhaps are aware that that opportunity exists.